So this last segment is going to look at irreversible or very long-acting acetylcholinesterase inhibitors. These drugs have an interesting story. They were really first developed in World War I as nerve agents, and they were kind of perfected between World War I and World War II. And in each instance, when Germany lost the war or wars, the Allied forces came into contact with these drugs and the German records. And so the American, French, British, and Russian um, countries all kind of got the recipe, so to speak, in terms of all of these biological warfare agents. And so Never Again turns into Yet Again in the modern era, this time moving to the Middle East and parts of Asia. And so in the 1980s, Saddam Hussein used some of these chemicals and some of these derivatives of these chemicals on Kurdish minorities. There was a Tokyo sarin attack in 1995 by a doomsday cult from Japan. And of course, we spent the better half of the Second Gulf War looking for weapons of mass destruction. We found them in the Syrian civil war, which basically has been going on now for about 5 or 6 years. And more recently, we saw Syrian, unfortunately, children and ethnic minorities being poisoned by the Assad regime. And so, these poisons have been around for a long time, and they persist in the environment. And so we have to teach you the history behind these, because if there ever is, God forbid, an attack, you have to know what these drugs are and what these chemicals are and how to treat them. And so they are organophosphate in their chemical origin, but they act as irreversible inhibitors of acetylcholinesterase. And so what they do is they block the degradation of acetylcholine, and the concentration of acetylcholine in the synapse rises dramatically, very dramatically. Okay. Now, the good news is that this can be reversed. There is an antidote out there, and even though they are considered irreversible, the irreversible component refers to how long they can bind and the intensity in which they can bind to the enzyme. We can kind of outcompete it. And so without going into the dramatic chemistry, the phosphate portion of the nerve agent kind of hovers over this S-steric site. And so what you can do is you can supply this rescue called 2-pralidoxim to basically go in there and kind of cleave that portion and occupy that other site, and you can get this drug off of the enzyme, or this toxin off of the enzyme. And so they are irreversible to some degree. Some of these drugs are so toxic that there's no time frame that would exist for you to rescue the patients or the victims, because death would occur so quickly. And so often the only people that actually have the rescue, unfortunately, are the people who are administering the warfare agent. And so the antagonist army or regime that's purposely poisoning the people has the 2-PAM rescue antidote on them. The people that are being poisoned typically don't have this, and they don't even know that the poisoning is coming. And so even though it can be reversed, it most often isn't, because there's no time. And so as grim as this sounds, you do have to kind of be aware of it. And our exercises in the CBCL session will kind of elaborate on this a little bit, and I hope you find it interesting and disturbing. Other irreversible inhibitors include organophosphate compounds that have been used as insecticides, and some of those compounds are listed here. This is cut from a pharmacology textbook. And these have an interesting story as well. And so these were actually derived from some of the gas agents that were used in World War I and then perfected in World War II. The nitrogen mustards were slowly developed into chemotherapeutic agents over the years. And then sarin, which is another, and so these are unrelated, but they're both weapons of mass destruction or bioterror type weapons, but they're different in chemistry. Sarin was reformatted and changed into common household insecticides. You can buy these at Home Depot. And malathion is a really common ingredient in terms of these insecticides, and it lets you grow really hard to grow plants like roses, but it's also been responsible for the demise of the bee population. Malathion specifically has been reformatted into a topical application that you can actually buy over the counter to control head lice in humans, okay, which is shown here. So these drugs have a really important history. Unfortunately, they also have a really dark history as well. And so these are horrible insecticides. They get into the environment. Many of them can be carcinogenic, teratogenic, and really cause devastating effects. There's an interesting story about DDT, which gets basically incorporated into the food chain and was responsible for the demise of the bald eagle. EPA efforts were kind of put in place to reverse this, and now we've got the bald eagle population has been kind of restored. And so what does this mean is that, well, basically a lot of these organophosphate insecticides, these also act as acetylcholinesterase inhibitors. And so patients that are exposed to these insecticides often present with the same symptoms that, although much milder, that the patients that were exposed to some of these or other organophosphate chemicals that are used in bioterror type attacks. Okay, and of course the CBCL session will go into this, but I just want you to take home the historical precedents for these drugs, which is really interesting historically, but also somewhat disturbing, and put it with what we've talked about already. And so, if you inhibit the activity of acetylcholinesterase, basically what you're doing is you're increasing the amount of acetylcholine within the synapse. This is like an indirect agonism of the muscarinic as well as nicotinic receptors, because remember, acetylcholine has affinity for both of these receptor subtypes. And so I want to leave you with this. What would that patient look like? And so what would the acute poisoning of some of these insecticides or some of these bioterror weapons look like? Okay, so I want you to think about that, and we'll kind of expand on that in the CBL session when we meet in person. Okay, so hopefully you thought this was interesting. This is a nice summary chart looking at the different muscarinic receptors, their anatomic location, the drugs that can act as agonists or antagonists, and then the mechanism by which they do that. And so I kind of like this kind of summary chart. So this concludes cholinergic pharmacology. I hope you found it interesting, and we'll develop some of these topics as we go through this case that's coming up next. And we'll return to cholinergics in the brain, behavior, and cognition. We'll talk about it again with smoking. We'll talk about it again with surgery and the induction of anesthesia and muscle paralysis. And we'll also talk about it in terms of cognition as well, in terms of Alzheimer's and Parkinson's disease. And so a lot of interesting pharmacology and history here, and so hopefully you've enjoyed that. Okay, thank you.